We're going to move on now to our next item of business, which is a debate on COVID-19, the next steps for the NHS. I would invite all members who wish to contribute in this debate to press their request to speak buttons. And I call on the Cabinet Secretary, Jean Freeman, to open the debate. Thank you.
Thank you very much, Presiding Officer. Presiding Officer, in the face of the COVID pandemic, in March, I placed our NHS on an emergency footing. In that time, NHS staff, in my opinion, have been nothing short of magnificent. And I know that they have the thanks of not only everyone in this chamber, but everyone across our nation. I've asked a huge amount of the staff of our health service. I've asked them to undertake the biggest restructuring of our NHS in the shortest possible time. And they delivered. Our cleaners, porters, ancillaries, students, administrators, nurses, call handlers, midwives, the list goes on, includes doctors, paramedics and others, worked doggedly to not only ensure COVID-19 patients were cared for, but that other urgent treatment could also continue. I know that I will never forget the work of our medical physicists in repurposing anaesthetic machines to operate as ventilators in an interim period. In primary care, a nationwide network of COVID-19 hubs and assessment centres was established, with NHS 24 providing initial triage, set up within 10 days of being commissioned, ensuring the effective management of mild and moderate coronavirus cases in the community and keeping the GP practice clear as best we could of COVID cases so that other patients could continue to be treated. Around 95% of consultations with patients have been conducted through near me or phone calls. NHS 24 continues to be the first port of call for any patients with queries about COVID-19 through the designated helpline. Because of the hard work of the men and women of the NHS, at no point in this outbreak to date has Scotland had insufficient acute or critical care capacity to deal with COVID-19 and emergency demand. I've asked a great deal of them, and now we are about to ask them for more. We are now at the point where we must carefully and cautiously plan the running of our NHS so that it moves to running as normally as possible, but doing that in as safe a way as we possibly can, because the virus remains. The latest estimates based on modelling tell us that COVID-19 reproduction rate, the R rate, is currently between 0.7 and 1 in Scotland. These estimates also tell us that on prevalence there are around 19,000 people in Scotland with a COVID-19 infection. In simple terms, if the R rate remains below 1, the overall prevalence will steadily decline. But conversely, if the R rate goes above 1, that means the number of infections are increasing. More infections mean more hospitalisations, more ICU usage and, bluntly, more deaths. I know that the sun has been shining this weekend and we're all feeling a little more hopeful now that some restrictions have been eased. But it gives me no pleasure to say this. This epidemic is far from over. The gains we've made are painfully fragile, and it will not take much to see those overturned and our progress go into reverse. Clearly, our recently launched Test and Protect programme will have a key role to play in helping to minimise the incidence and transmission rate going forward. And we continue to remind people that to make it work, anyone with symptoms must isolate at home and book a test. But even so, there is very little headroom for change. So we move forward cautiously. We must remember that there is a 2 to 3 week time lag before we see the full impact of any easing of the lockdown restrictions. So we will start to remobilise the NHS, but I have to be clear that this will be no flick of the switch moment. Remobilising in these circumstances, where the virus is still with us and the impact of changes in restrictions need to be carefully and continuously monitored, is a complex undertaking, balancing many factors, some of which will change over time, and therefore making this a long-term as well as a complex exercise. Over the next 100 days, Scotland's National Health Service will remain on an emergency footing and will have 3 core tasks. Firstly, moving to deliver as many of its normal services as possible, only as safely as possible. Secondly, ensuring we have the capacity that is necessary to deal with the continuing presence of COVID-19. And thirdly, preparing the health and care services for the winter season, including replenishing stockpiles and readying services. Part of moving to deliver services as normally as possible must be a recognition that as we've asked so much from our staff, we need to ensure that they, as individuals and as teams, have recovery time, and that the improvements we have seen in practical and other steps to support staff well-being are not only retained but are spread. The remobilisation of our NHS is a whole system exercise. Health services matter as much in the community as they do in the acute setting. And that's why we plan to see the phased resumption of some GP services that can be supported by an increase in digital consultations. We're also rolling out the NHS Pharmacy First Scotland service in community pharmacies, including consultations and exploring what other care they can safely support that was previously undertaken by other parts of the NHS. In addition to emergency dental hubs, increasing the care that they can provide, our Chief Dental Officer is working with dental teams to prepare for a phased introduction of dental services over the course of this month, making sure, as every part of the health service will, that plans are fully compliant with current COVID-19 guidance and safe for both patients and staff. The NHS will continue to provide increased direct support to care homes that we have seen, making sure the clinical advice and guidance is where it needs to be, building on the strong links that exist between primary care and this sector. Yes.
Neil Findlay.
The Secretary's mentioned returning to normal. I hope we really don't return to normal, because normal would mean delayed discharge, normal would mean waiting times growing. So, in order to avoid us going back to normal, will there be a continued funding of all those places in care homes or social care places that the government didn't fund that resulted in all those people being stuck in hospital?
Cabinet Secretary.
So I take Mr Findlay's point. I don't want us to return to normal. That's why the document I published talks not only about remobilising and recovering, it talks about redesign. And I will go on to talk a little about some of the significant changes in service and care delivery that we have seen that we intend to retain. And in terms of the overall funding for our NHS, of course, our funding for our NHS has grown exponentially over the years of this government and the previous government, and that includes our support for social care. But of course, the social care landscape is a mixed landscape, and those private providers and others have a direct responsibility to ensure that the income they receive is matched by the quality of care for their residents and, of course, for their staff. We've, as Mr Findlay knows, had to step in there to ensure that that staff in our care homes were not penalised by having to stay at home if they were COVID positive. So we will continue to look at those matters. The framework I've published sets out the guiding principles that will underpin this work and how we will go about it and make those critical decisions, guided by clinical prioritisation. It sets the broad direction not only for remobilising the NHS in Scotland, but as importantly, the recovery and the redesign of service. The aim is to set out a clear evidence-based methodology which promotes as much robust and informed decision-making as possible, because we won't be able to restart everything at the same time. The NHS, of course, does not exist in isolation. The ongoing iterative development of these plans needs to be founded on a whole health and care system approach. So we will continue to involve important partners such as the RCN, the BMA, the other unions, our partners in local authorities and IJBs, the third sector, and clinical stakeholders such as the Royal Colleges and the clinical networks. But the patient's voice matters too. And that's why I've asked our National Clinical Director to work with the Health and Care Alliance to find the right ways to make sure we hear what matters to patients and pay attention to that in all our planning. Collectively, these groups will feed into the Framework for Mobilisation Recovery Group, which I will chair. The initial board remobilisation plans that I've now received take us to the end of July, And the immediate priorities, as members would expect, cover cancer, elective procedures, mental health, primary care, and important quality of life and preventative care services, such as pain clinics, dental care, optometry, and the planning for the return of screening services. In looking to how we slowly and safely remobilise and recover whilst preserving capacity to deal with COVID-19 and emergency resilience, I want to retain as much new and innovative practice as possible. Our NHS didn't just gear up to meet the challenge of the pandemic. In many ways, it transformed itself. We've seen some remarkable developments in service delivery with new and improved patient pathways and the use of digital technology, enabling more care to be delivered at home or in the community. The rapid expansion of digital access to therapies has led to innovations in mental health, like the virtual hub in NHS Grampian, accessed via self-referral for the benefit of local staff and patients, including children, with 250 people accessing that service in its first 6 weeks. That is just one example, and there are many more. Not all might work in the new landscape, but many will and have proven themselves to be effective. Where new and innovative ways of working have shown themselves to deliver quality and safe care, we will work hard to hang on to them, always remembering that what matters to patients is the quality of care, but also the quality of that connection between them and the individual that cares for them. Presiding Officer, I am acutely aware that the rapid reconfiguration of our NHS was not without cost to other patients. We all increasingly understand the cost of dealing with this pandemic to health and to our well-being. It has brought worry, continuing pain and anxiety for many. Stopping large and important areas of healthcare was never a decision I would have taken if I felt I had any other choice, and I deeply regret the pain and the anguish that caused. But there was no other choice. Lives were, and still do, remain at stake. In responding to the challenge of COVID-19, we have asked a very great deal of our NHS and care staff, of key workers across many sectors and of the public. All that they have sacrificed have got us to where we are today, cautiously optimistic that we can both control the virus, slowly ease our way out of lockdown and begin to restart areas of healthcare that we stopped. But I have to ask for more again, and more again from all of us. I have to ask every single person to please keep to the rules. Stay at home remains the core message. The reasons for leaving home have increased in a small way, but taking all those vital public health steps to prevent the transmission of the virus are even more important now because we can leave home more. I do know it's hard. I know that you feel that if you just bend the rules a wee bit, it will be fine. But if we all bend the rules a wee bit, then this virus will seize that opportunity and the gains made will be lost, and the opportunity we now have of giving more people the care they need will disappear. We're on the right course. We're ready to begin safely and cautiously remobilising and recovering our health service. Please help us stay that course, and please help us improve it too. Thank you.
Thank you. I call Miles Briggs to be followed by Monica Lennon.
Thank you, Presiding Officer. I'd like to thank the many organisations who have provided useful briefings for today's debate, including Chest, Heart and Stroke Scotland, the RCN, BMA Scotland and Scottish Health Action on alcohol problems. And like the Cabinet Secretary, I want to begin by expressing my continued thanks and gratitude to all our health and social care workers and for the amazing work and incredible hard work they have put in during the COVID-19 pandemic, and whose contribution cannot and must not be forgotten. This is an important debate. It has been clear for some time now that the NHS does not have the capacity required to be able to restart all the many postponed services, and for so many people over this period of time have been at home suffering in pain. For some weeks now, Scottish Conservatives have been calling for ministers to set out a detailed and comprehensive NHS recovery plan to restart our NHS services and allow our constituents to access them safely. Many health charities, organisations and members of the public have also been calling for this. Now, I note the Cabinet Secretary's announcement on Sunday and the publication of the framework, but I fear it falls short of the plan we need to see, and it lacks a detailed timetable of when these services will be available. So I'd like to ask the Cabinet Secretary to consider a number of positive ideas which opposition parties have put forward and suggested to ministers, and that these will be taken forward as we emerge from the COVID-19 outbreak, and I will return to that point later. Resuming cancer screening and all cancer treatments is a key area of concern and was the main topic of our recent cross-party group on cancer meeting. Cancer Research UK has undertaken excellent work in analysing the impact the crisis has had and points out there will be a substantial number of early cancers left undetected before screening programmes are reintroduced, while the number of people being sent on an urgent referral for further investigation or diagnostic tests for suspected cancer dropped by as much as 72% during the early stages of the pandemic. Cancer Research UK highlights that despite national guidelines stating that urgent and essential cancer treatments must continue during the pandemic, this does not seem to have been consistently taking place across Scotland. And it sets out a number of positive recommendations for moving forward, including the creation of safe spaces for cancer patients and to minimise COVID-19 exposure, and appropriate safety netting and management of people affected by the suspension of cancer screening programmes to ensure these people can receive a seamless reintegration into this screening pathway in the months ahead. Cancer Research UK, like many other health organisations, is also backing the restarting of clinical trials once the environment is right for them to restart and continue safely. And I welcome the suggestion that pain clinics may soon reopen as well, as this is something chronic pain patients across Scotland have been desperate to see happen. I recently convened a meeting of the cross-party group on chronic pain, and a number of the patients expressed their really serious concerns at the impact that lockdown had had on their health and their quality of life. Indeed, some patients described how they felt totally abandoned, with some actually dependent on infusions and injections, having to be forced to manage to travel to England and pay for private treatment to get those injections. The toll on their mental health, I think, is the key part of what we were hearing. Chronic pain patients have been unable to access treatment, and it's had a hugely significant impact on their mental well-being. MSP members of the cross-party group have written to the Health Secretary in detail asking for her to look into these issues, and I look forward to that full response. And mental health services is the one area the Cabinet Secretary didn't expand on, but I think is really important. It's a priority for urgent restarting, and given the anticipated increase in people who will be trying to access mental health services and support, including CAMS support, we need to hear from ministers how they plan to expand capacity so that waiting times, which were already unacceptably long before this pandemic, do not become even more excessive and vulnerable people can access these services as quickly as possible. I'm sure, like I have, members across the chamber will have had representations from anxious constituents trying to access treatment for dental problems, which, while not urgent, may be extremely painful and which are having a negative impact on their everyday lives. I'd be grateful if ministers could set out more detail today of when we can expect key non-urgent dental treatment to begin again, and how and when they envisage non-urgent aerosol generating procedures to be reintroduced, looking at best practice which is going on currently internationally. BMA Scotland have a number of important points in their briefing which they highlighted, not least in terms of ensuring all NHS and social care staff are fully protected and have access to appropriate and sufficient PPE. Given the ongoing needs of PPE, and this is likely to increase as more services resume, we need to be confident that our procurement policies can ensure that we have enough going forward so that staff can be confident in their workplace. I also very much agree with the BMA in relation to staff well-being and its improvements being made during this difficult period, during the pandemic, such as the local introduction of well-being spaces for the removal, as well as the removal of parking charges. These must not be lost as we take steps to normalise services. The RCN also rightly makes the point that all healthcare staff must have access to high-quality counselling and psychological support, and I think this is a really important aspect. We already know that significant numbers of our NHS professionals are reporting higher levels of stress and the negative impact which the COVID outbreak has had on their well-being and that of their families. A huge concern for all healthcare professionals and for all of us in the post-outbreak period will be the impact and the increasing need of NHS staff presenting with mental health concerns. So we must start the work now to provide the support that we know will be needed. Cancer Research UK has also rightly argued in relation to cancer treatment that the longer we run without a full range of services, the greater the likelihood we will see reduced patient experience of care and quality of life, as well as all our national cancer outcomes. This applies across all of our health services, and why every effort must be made to now restore services while also ensuring that this is done safely and sustainably. Today's debate is rightly about the future. Those who work in our health and social care services want to see a change after this pandemic is over. The COVID-19 public health emergency has demonstrated the outstanding commitment and dedication of our NHS and healthcare professionals. And it's clear that for some time NHS staff have wanted to see a real change, as Neil Findlay outlined. The way in which our NHS services are delivered and the way the NHS operates fundamentally has changed during this crisis. And out of every crisis can be an opportunity to change. And I know that NHS staff are determined that their hopes and aspirations for a different normal can be realised. Prior to the COVID-19 outbreak, SNP ministers were failing to meet any of their own waiting time targets and health targets. There can be, and I hope there will be, an opportunity for a new cross-party consensus to help improve and secure the future success of our Scottish NHS. Over a year ago in this chamber, I led a debate calling for a review of support for NHS staff and a more holistic approach to support them. It's clear that the public across Scotland now support that and want to see our NHS and social care staff not just given our thanks, but also given our support in helping to make their life-saving work safer and more rewarding. If there's one lesson I hope we've all learned during the public health emergency, it is this. When we empower our healthcare professionals and allow them to take decisions, then they will always step up and deliver the care in most difficult circumstances. So to conclude, Presiding Officer, Scottish Conservatives will continue to work with patients, health charities, representative organisations to scrutinise the Scottish Government's actions. We owe it to each and every one of those NHS staff and social care staff who has stepped up to care for our fellow Scots during the outbreak to stop and listen to what they want to see. We have an opportunity to come out of this crisis and build a health system that actually meets the increasing challenges of an ageing population, and one which delivers the modern and preventative health-focused work and services that we all want to see, which will help build that healthier, happier nation which we all want to see in the future. Thank you.
Thank you very much, Mr Briggs. And I call Monica Lennon to be followed by Alison Johnson. Monica Lennon.
Thank you, Presiding Officer, and I'm pleased to see you've made a good recovery and you're back in your rightful place. On behalf of Scottish Labour, I want to begin by thanking all of Scotland's healthcare staff for their service to our country during this awful pandemic. COVID-19 has crashed into our lives and made us all less certain about the future. We can be certain, however, that we will always need the National Health Service. If the NHS had not been created by Labour 72 years ago, we would be at the front of the line today calling for its creation now, so that healthcare free at the point of need is universally available to all of us. There's no getting away from the fact that this global pandemic is presenting enormous challenges to healthcare systems right around the world. And that is why we welcome today's debate on the Scottish Government's Remobilise, Recover, Redesign framework for NHS Scotland as an opportunity to address the challenges facing our health and social care services in the short, medium and long term. For the past 11 weeks, the NHS in Scotland has been on an emergency footing, and we've seen what life is like when parts of the health service are in lockdown or simply not available to us. And we understand why there had to be an immediate focus on freeing up capacity and planning for the worst case scenario. And the Scottish Government has never tried to sugarcoat this drastic decision. Ministers and officials have always been clear that the virus would cause direct harms and indirect harms. Despite every effort to protect the NHS and save lives, tragically, Scotland's deaths have contributed to a devastating picture across the UK, where collectively our death rate is believed to be one of the highest in the world. The high number of non-COVID excess deaths, around 915 since the middle of March, has prompted the Scottish Government and the Chief Medical Officer many times during the past few weeks to ramp up the message that the NHS is still open. And we all know constituents and people who have been worried to see their doctor about changes in their health, whether it's lumps or unusual bleeding. So it's been good that we've heard those messages coming directly from government, but we have seen a huge reduction in urgent cancer referrals, and we know that's because patients have been staying away. We see this too in A&E, where attendances have remained historically low throughout the lockdown periods. Urgent treatment is supposed to be continuing, but we all know constituents who've been unable to access urgent medical treatment. And earlier today, official figures have confirmed that the number of planned operations was down by over 80% in April, while over a third of children and young people waiting to be seen by CAMS have been waiting longer than 4.5 months. So we know that we're storing up a backlog of health problems. But in terms of some of the immediate priorities, Miles Briggs has mentioned a couple of the briefings that have come in, and I think we've all been speaking to the same stakeholders and organisations in recent weeks. So I think there will be a repetition in terms of the themes today, but if I begin by speaking about cancer, because we know that cancer is the leading cause of death in Scotland. And before COVID-19, around 34,000 new cases of cancer were diagnosed in Scotland each year, and sadly around 16,000 deaths to cancer. So cancer won't stop simply because of this pandemic. And I agree with Cancer Research UK. In fact, I support their campaign, Safe Spaces for Cancer Services. And the disruption to cancer testing and treatment, we know, could have potentially devastating results for people's survival. And I know that Macmillan Cancer Support, I look around the room here to all the briefings that I have pinned up, I know that these are issues that matter deeply to our cancer charities who do fantastic work all year. But the Parliament heard evidence from Professor Linda Bald a few weeks ago now, and I've mentioned this to the Deputy First Minister when he's appeared at the COVID-19 committee, and she has made clear that staff stand ready to deliver, once again, the cancer screening programme. But we need to factor in access to PPE, and we need to factor in testing and screening for patients. I would really like to see more detail on how the Scottish Government is going to get our staff ready and safe working environments, because we do need to have safe spaces to get life-saving services around cancer up and running. And I do agree that we need to make mental health a priority. The RCN Scotland have set this out helpfully in their briefing, and I do agree with them that the framework at this stage is a little light on detail, but I think that's particularly true of mental health services. So I think we have to work collectively to get that right. And the Cabinet Secretary will be aware that I wrote to her recently about further clarity on mental health support for staff and a plan to address the risks and harms associated with post-traumatic stress disorder. And I see that BMA Scotland of doctors said that they're suffering from anxiety, depression, stress or burnout. And I think there is a real cross-party consensus building. I think members across the chamber, we see it through the cross-party groups that we're members of, but I think there is a real willingness to support the government's effort, to support the national collective effort. And I think rather than the cross-party groups being seen as something that sits outside Parliament, and we come to the Cabinet Secretary with a list of problems and challenges, I think we all want to see closer working so that the opposition parties can work alongside the government when these frameworks and plans are being worked up. But Miles Briggs is right to highlight the challenges facing chronic pain patients. Again, these are issues that have been problematic for years, but we heard testimony from patients who have been feeling suicidal because they're completely isolated, they're completely shielded and not in contact with anyone, so are unlikely to have the virus, but they can't get these infusions and injections that Miles Briggs referred to. And again, I pay tribute to the cross-party group on cancer. I'm sure my colleague Anas Sarwar will speak more about the work that him and Miles Briggs have been leading there. So there is that appetite to work across party boundaries. But Scottish Labour is completely realistic. We know that in terms of recovery planning, it's not possible to resume all NHS services overnight, and it does require weeks and if not months of careful planning, and we want to work with the government on that. The Cabinet Secretary was right to say that the NHS doesn't exist in isolation. It can't work alone. I wholeheartedly agree, and that's why I'd like to see more certainty for charities like Chest Heart Stroke Scotland, who have a fantastic hospital at home programme, but at the moment they only have financial support from government for up to a maximum of 3 months. So we need to know what support will be in place so that charities can health charities in particular, can plan for the longer term. In conclusion, Presiding Officer, there's so much to say and there's no time left, but I mentioned the National Health Service and the values that underpinned that those 72 years ago. In this debate, I've not had time today to talk about the impact on older people and the fact that our care homes remain at the centre of this crisis. We need a national care service. We need to have consistency in terms of standards and quality and access right across Scotland. And never again can we have a situation where people are cleared out of hospitals without proper testing and screening and into care homes where health support has not been available. I look forward to hearing more from the Cabinet Secretary on that, but we have to remember that in this crisis that health and care workers have also lost their lives and have become unwell in this crisis, and we all have to work for their benefit and for the benefit of all patients in Scotland to make sure that we learn lessons quickly and don't take questions or criticism in any way as a negative, but as an opportunity to do better for the future. Thank you.
Thank you very much. I now call Alison Johnson to be followed by Alex Cole-Hamilton.
Thank you, Presiding Officer. And I too would like to express my heartfelt gratitude to all of those in the NHS who are working so hard to keep us safe. We owe it to them to amplify voices within the health service and within care in this chamber. Scotland's health service hasn't been overwhelmed during the COVID-19 outbreak, and this is down to the incredible efforts of all working in health and care. But this doesn't mean that it hasn't been overwhelming at times for those working in health and care in Scotland. Staff in those areas have been subject to extremely difficult conditions, and they've undertaken their work at great personal risk, due in part to inadequate stockpiling of PPE. A recent survey by the Royal College of Nursing revealed that 69% of respondents had raised concerns about PPE, and 46%, including those working in the most high-risk environments, reported that they had felt pressured to care for a patient without appropriate PPE. Now, this has added to the stress and anxiety that staff are feeling when working during the pandemic. Our health service faced staff shortages and huge challenges before the pandemic, and we have to bear in mind that there may indeed be staff working in the NHS and in care at the moment who will be affected by post-traumatic stress. There may be many staff whose mental health and well-being is being impacted, so we need to be clear that we're prepared to help them, that the support is there and they can access it easily. Staff also need a guarantee that, given the likelihood of a future pandemic, proper planning is taking place, lessons are being learned, and that shortages of PPE won't recur. We need to ensure that staff feel as safe as they possibly can when they go to work during and after this crisis, and routine testing of those working within the NHS and in care is essential, and it's still the case. We've visited this earlier today. Too much testing capacity goes unused. On Saturday, the number of tests carried out fell to its lowest level in over a month, with only a fifth of Scotland's testing capacity being used. And there remain significant concerns that infected healthcare workers who are pre-symptomatic, asymptomatic or suffering from mild symptoms may be spreading COVID-19. So if you use that capacity properly, you could help reduce anxiety, better protect frontline staff, ensure that no one needs to isolate needlessly, and encourage patients to engage with services. And we urgently need more information too on the effects of COVID-19 on black and minority ethnic people. Public Health Scotland has published preliminary analysis which suggests there hasn't been a higher level of coronavirus cases amongst Scotland's black and minority ethnic communities than would be expected. But the First Minister has acknowledged that this data is very limited. We need detailed analysis now so that people fully appreciate the risks. We can't rely entirely on the efforts of our wonderful NHS workers to pull us through crisis after crisis. We owe them more than that. To reduce the strain on staff and ensure the sustainability of the NHS, we have to focus more on prevention. In its 2018 paper, The Role of NHS in Prevention, the Faculty of Public Health stated that the NHS remains first and foremost a treatment service. So we need a new approach to ensure our NHS is in place for generations to come, and tackling inequalities must be a key tenet of that approach. Multiple studies have shown that income is the most important social determinant of health. The Joseph Rowntree Foundation tell us that health improvement policies rely only on initiatives that target specific risk factors or deliver single interventions are in danger of being insufficiently comprehensive to yield anything more than modest benefits. Food poverty, period poverty and fuel poverty all have the same root cause, a lack of insufficient and secure income. So we need to take a more holistic approach to health. Implementing a universal basic income to ensure that everyone has enough money to live on would help. And the impact of the COVID-19 outbreak has driven home the importance of such a policy. Too many people in this country are surviving on precarious incomes and living in insecure tenancies. The third sector too has a key role to play in prevention, in improving health, and many from this sector are warning that they face significant financial risks. They will need support to survive the crisis. So the support that's been provided to date has helped set up digital or short-term COVID-specific projects, but more long-term support must be guaranteed, because social distancing will impact on their fundraising ability, on their shop income. So the real challenges for this sector they go well beyond the pandemic, just when services like the NHS will need them most. I'm glad to see the resumption of suspended services, such as cancer services and some mental health support. Cancer Research UK, the British Heart Foundation, Chest, Heart and Stroke Scotland have been contacting us all. They cannot wait to be able to properly help those who need their help most. So some measures taken to protect our NHS during the crisis can have a positive and lasting effect on how services are run, such as the delivery of digital consultations where appropriate. And the role of pharmacists too has been highlighted during the pandemic. They have an important role to play in the delivery of community services. I welcome the rollout of the Pharmacy First Scotland service in community pharmacies during Phase 1. We need to fully use the expertise of these highly skilled professionals. An increased focus on community pharmacy as the first port of call for managing self-limiting illnesses and supporting self-management of long-term conditions is a positive step. It lessens the strain on our GPs and it lets pharmacists contribute more fully to the multidisciplinary team. In closing, I'd like to focus on our care service. As we know, 46% of COVID-19 deaths registered by National Records of Scotland are related to deaths in care homes. These horrifying numbers have emphasised that our care system must be reviewed as a matter of great urgency. We need a public care service akin to our NHS. I welcome the fact discussion has finally started. These conversations must be sustained, not abandoned, as they have been so many times before by successive governments. Fragmented delivery in a postcode lottery isn't good enough. We owe it to our elderly people, many of whom have suffered immeasurably in the past few months, to rethink how we value them, to commit to properly look after all our older citizens, to repay them properly after a lifetime of contributing to society. We need to place human rights at the heart of social care. The impact of austerity has seriously undermined efforts to embed human rights in the delivery of social care. It has impacted on wider society's resilience. We must build back better, and a properly resourced, well-staffed National Health and Care Service can begin to right this wrong. Thank you, Presiding Officer.
Thank you very much. I now call Alex Cole-Hamilton, after which we will move into the open debate.
Thank you very much, Presiding Officer. Can I start by echoing the very eloquent words of Alison Johnson there about the need for a national care service? It is a view shared by my party. I also thank her and echo her comments about praise for our hard-working NHS and social care key workers. Presiding Officer, in the foothills of this emergency, this country was gripped by a fear that has not yet dissipated. In the space of a week, we'd gone from public health messaging around bumping elbows to the strictures of lockdown. I remember that sense of creeping anxiety in this building when all but members and a handful of parliamentary staff were asked to work from home. This place felt like a tomb, as if every surface was crawling with virus. Presiding Officer, I don't remember a time in my life when I have felt more afraid. And that fear was replicated in our communities. By the time that lockdown came, people were already begging for it to be imposed. We'd seen images coming out of Bergamo and Madrid. We were aware of ice rinks being mobilised as potential mortuaries, and we watched in shocked admiration as the NHS Louisa Jordan was erected in just a matter of weeks. It was wholly unsurprising then when the government postponed all non-urgent elective surgery in the first days of lockdown, and I received not one single complaint or note of concern in my parliamentary inbox about that decision. People felt the risk of going where COVID-19 was likely to be was too acute for them to take the risk or to take issue with that decision. Presiding Officer, near the start of the year, you may recall that I brought the case of Margaret Simpson to the attention of the Cabinet Secretary. In 2018, Margaret had been injured during a colonoscopy and was fitted with a temporary stoma bag while she was placed on a waiting list for corrective surgery. She waited and she waited. By Christmas last year, the pre-op medication she'd been given to take home in preparation for that surgery had passed its use-by date, and so she got in touch with me. I raised her case in the chamber, in the papers and in NHS Lothian until she was finally given a date for her surgery in the middle of April. So, Presiding Officer, when the government cancelled all non-urgent operations, hers was the first number I called. I stressed to her that given the inconvenience and suffering that she'd already experienced, that we could now easily make a case to the Health Board that hers was indeed an urgent procedure. But she was quite clear, however, that she just was not ready to take that risk, that the fear of COVID was too great for her to entertain the prospect of entering any part of the health service estate. Presiding Officer, she's not alone. I have an immediate family member in need of an urgent hip revision who has spent the best part of 10 weeks on crutches and in abject pain, but is prepared to spend 10 weeks more like that if need be, rather than risk a hospital stay. There are stories like this the country over, and they can be measured empirically in our health service statistics. April saw an 83% reduction in surgical operations on the previous month. There have been as many as 16,000 fewer cancer referrals. A&E departments are deserted. This reality is concerning on several levels. Firstly, it suggests a tremendous level of human suffering in our communities that should otherwise be dealt with in primary care. It suggests a massive drop-off in health surveillance, with many diseases and conditions going undetected early enough to do something about them. And it suggests that our national response to COVID-19, as reasonable as it may be, will lead to a human cost and a loss of life beyond those who have been taken by the virus. Presiding Officer, I know this last point is deeply troubling to all of us. In the first 10 weeks of lockdown, deaths in the home rose by 67%, yet only 15% of these deaths were as a result of coronavirus. These must have been people who in need of healthcare, but who, like Margaret Simpson and so many others, were too frightened to access it. So let me echo the words of others in this chamber throughout this emergency. If you are unwell, if you experience signs like abnormal bleeding, chest pains or a new lump, please get help. You can be certain that you will be seen and that you will be seen safely. I also want to close by asking the Minister to focus her efforts as we revive parts of our NHS on three key areas of the health sector. Firstly, I ask her that she consider the full recommencement of all types of cancer screening programmes. We know that cancer referral and diagnosis have dropped off a cliff. The long-term impact of missing an early diagnosis, both for these patients and ultimately for our health service, cannot be overstated. Secondly, her government must redouble their efforts on child and adolescent mental health services. Many children had waited over a year for treatment just at the outset of this crisis. In the intervening months, young people have experienced the disruption of their education, removal of freedom, and loss of contact with peers
and loved ones. It is inevitable, therefore, that more children and young people will need help and support through CAMHS, but they deserve better than to join one of the longest queues in the entire health service. Finally, I ask her to look at dentistry. Every member of this Parliament will have received emails from constituents in agony, parked on antibiotics and awaiting fillings, root canal work, or other aerosol-generating procedures. I'm sure, like me, they have also been contacted by dentists desperate to get back to work and to help those patients. They are confident that they can do those procedures safely with the right kit. Presiding Officer, this Parliament and this country will never be able to fully repay the debt we owe our NHS. It has weathered the first of the storms of COVID-19, but prevailed and done so admirably. It has shown itself capable of doing so and with capacity to spare. So while we have a bit of breathing space, while our clinicians are coping, please let's restart some of the normal day-to-day provision of our NHS where it is safe to do so, so that we can alleviate some of the suffering in our communities. Thank you.
Thank you very much. And we now move to the open debate, and I call Angela Constance to be followed by Annie Wells.
Thank you, Presiding Officer. It is impossible to consider and debate the next steps for our National Health Service in isolation from social care and indeed care homes. As acknowledged by the Government and others, the pandemic has demonstrated the crucial interdependence between the different parts of the health and social care system and has exposed and exacerbated health and social inequalities. Indeed, the Cabinet Secretary in her opening remarks states that a whole systems response continues to be required to combat COVID and that a whole systems approach to life beyond COVID is not just required but essential. The framework for NHS Scotland is titled Remobilise, Recover and Redesign, and it's the future that I want to focus on. It's the prospect of a better future that gives us all hope. And I know that I am not alone in having much to reflect on, either personally or politically, in the past few months. In short, I too would like to see a national care service on a par with our National Health Service. But let me be clear, I do not want care services run like hospitals, with councils or charities cut out of the loop. But I want a refocus on not-for-profit care. I want a clear national plan and infrastructure that builds and supports local services around the everyday needs of people in their own homes or in their own community, with lines of accountability and redress that are as clear as crystal. And I certainly want a dispassionate examination of the so-called mixed economy of care that has been with us since the 1993 Community Care Act. This pandemic has shone a light on the serious concerns about some private care homes, and while I would not want to tar all private providers with the same brush, but we need to be clear, profiteering at the expense of care cannot and must not be tolerated. And my concern, given how some large private care providers operate, is that millions of pounds of public money is taken from the care sector into the financial sector, particularly when care homes are sold, with care home fees being extracted for profit and paying for the building time and time again. And we need to interrogate the ethics and the fairness of the financial models that underpin care and evaluate what impact this has on the well-being of residents. Forgive me, Mr Finlay, I won't, because I really don't want to get over-emotional about this. I have written to the Health Secretary calling for an investigation into the differential impact of COVID-19 deaths right across care homes in the public, private and third sector. And my reason for doing so is rooted in the Scottish Government's own statistics, most recently on the 27th of May. To date, the percentage of adult care homes that have seen a suspected case of COVID by sector is 38% in the voluntary not-for-profit sector, 57% in the public sector and 69% in the private sector. Scottish Government statistics also show that a higher proportion of larger adult care homes have more suspected COVID-19 cases. For example, 17% of adult care homes with 10 beds or less have suspected COVID-19 cases. By contrast, 91% of adult care homes with more than 60 beds have suspected COVID-19 cases. So going forward, it is imperative that we examine which sector prefers large care homes and why, as well as the need for transparency about the tragic loss of life in care homes sector by sector. There are also massive questions to be asked about the role, remit and powers afforded to registration and inspection services. I have recently written to the Care Inspectorate and the Nurse Director for NHS Lothian, and I'm hoping for a productive response, about a constituent who has been diagnosed with coronavirus and his family are worried sick about the private care home's ability to cope. And they are asking, I suppose, pleading for nursing staff from the health sector to go into the care home sector. We know that nursing vacancies in the private sector are high, around 50%. Compare that to the voluntary sector, it's about 15%. And independently, a local funeral director has also raised concerns about the same home. And I know that in response to the pandemic, the government is working with the care sector as it is currently constructed. And the Cabinet Secretary is quite right to point out that she has stepped into the private sector to pick up the pieces about concerns, about terms and conditions of employment, whether that's death and service benefits, whether it's pay, whether it's sickness benefits. She's also stepped in with regards to the supply of PPE. And we now have, and I think this is very significant, we now have NHS nurse directors assuming professional responsibility and accountability for infection, prevention and control in all care homes. And we can't turn our back on this. We can now only go forward. Presiding Officer, as we look to a new life beyond lockdown, there are some fundamental questions to be asked and answered about how we best care for our most vulnerable yet cherished of citizens. And I hope that we can start to do that constructively and together sooner as opposed to later. Thank you.
Thank you very much. I now call Annie Wells to be followed by George Adam.
Thank you, Presiding Officer. Firstly, I would like to put down my thanks to every NHS and care worker. Over the past 10 weeks, you've done so much to look after the vulnerable in our society. And also thanks to all the emergency and key workers as well as the thousands of volunteers who are helping out in their community. No amount of thanks could ever convey how grateful we are to each and every one of you, but thank you. It is an underestimate to say that coronavirus has brought many changes to our daily lives, not at least within our NHS, which has seen the largest reconfiguration of the service in its history. The NHS was put on an emergency footing in March, and with that came the cancellation of non-urgent elective surgery, and a few weeks later, the suspension of screening services for breast and bowel cancer. The health service needed to be ready for a surge of cases in the beginning of this pandemic. But now it's time, the Scottish Government, to safely restart services for those who are suffering in silence. Otherwise, lives will be at risk. A few weeks ago, Cancer Research UK warned that Scotland faces a significant cancer crisis due to a backlog in diagnosis and treatment. They said the number of people being sent on an urgent referral for suspected cancer dropped by 72% during the early stage of the pandemic, with around 2,000 urgent suspected cancer referrals not happening each week. They urged the Scottish Government to set out a strategy to return cancer services to pre-coronavirus levels. A number of wider programmes will be vital as we move out of lockdown. to look to restart the NHS. The first being TTI. At the start of last month, we agreed that it was vital for the test, trace and isolate strategy to be a success. It will be key in suppressing the virus and hopefully put us on a path to some sense of normality. However, recent developments have shaken public trust in previous contact tracing operations, no more so than the failure to inform the public of a coronavirus outbreak at a night conference in Edinburgh in late February. We all know of the details that have emerged where numerous people who came into contact with conference delegates were not contacted by the tracing team. And none more worrying than the case of kilt fitter Gillian Russell, who had to take time off work with flu-like symptoms shortly after spending more than an hour fitting kilts for night conference delegates. Shockingly, Gillian only found out about the outbreak through media reports. This cannot happen again. We also found it disappointing to see the playing down of the 2,000 additional contract tracers that were promised for the strategy to work. The past week seen varying numbers of tracers which claim that only 700 would be needed in the beginning, and it is still unclear whether the ones that have been hired so far come from outside the NHS. We believe that everything must be done to ensure that TTI is not only a success, but has the confidence of the public. Additionally, the success of the TTI strategy will depend on the second T in TTI, testing. The Scottish Government announced that capacity is at over 15,000 for tests. But as we've heard, shockingly, only a third of this capacity is being used daily. The Scottish Conservatives have repeatedly called for the Scottish Government to get testing capacity out into the community, particularly for carers working with the most vulnerable groups. This type of testing will vastly improve data, which will enable us to move out of lockdown and restart our NHS. As government's ministers have said themselves, there is no point in having capacity unless you use it. I found it promising one of the Scottish Government's own publications showed forecasting data that says both hospital beds and ICU capacity has not been breached. And that to August, all scenarios show it not being breached. The capacity is there. It's time to put it to use. Presiding Officer, I said earlier the NHS has rightly diverted time and resources to tackling coronavirus. In such an unprecedented time, it was only right that steps were taken at the start of this crisis to make sure the NHS was ready for a surge in coronavirus cases. But now it's time for the Scottish Government to safely restart screening and operations. As these next steps are taken, the safety of staff and patients must be at the forefront. Presiding Officer, the NHS did not fail us in this crisis, and moving forward, we must not fail it. Thank you.
Thank you very much. I remind members that those contributing remotely are not able to take interventions. I'm sure there will be other opportunities will arise during the debate to rebut any points that members wish to rebut. Can I now call George Adam to be followed by Neil Findlay?
Thank you, Presiding Officer. I'm grateful to speak in this debate today as first and foremost our NHS is truly a wonderful thing and must be top of our priority list during these unprecedented times. I think everyone across the chamber will agree with me when I say that our healthcare workers, from doctors, nurses, to hospital porters and social carers, ambulance staff and all those that are involved in the NHS have all performed admirably under what I can only imagine are incredibly challenging circumstances. In our popular culture, superheroes fly about saving the universe in big budget movies. Ancient mythology of heroes saving the weak and those in need have been repackaged for the 21st century. But I think in these challenging times it has been proven that superheroes are alive and well, living and working among us in our communities right now. That is why it is vitally important that we get it right moving forward to ensure our NHS can operate at peak level as we transition out of lockdown and through to the 4 phases of the new normal. The Scottish Government's main priority has remained the same throughout this global pandemic. to save lives and protect the most vulnerable. And this is why what will be at the heart of the next steps for our NHS. In order to continue to do so, the core message always remains the same: stay home and save lives. The difficult sacrifices we are all making in our communities are working. However, this progress remains fragile, and despite entering phase 1 of the transition process, we should still stay at home as much as possible to ensure that the virus does not spike again and take us back to square one. I think it is important here to absolutely acknowledge how hard these restrictions are for many people across the country who are experiencing extreme loneliness and isolation while physically cut off from their families, friends, colleagues and loved ones. I'm sure for many households, technology has been a godsend right now. Video calling, FaceTime and MS Teams. I too am feeling the strain of not being able to hug my grandchildren and interact with them face to face. Every single one of us understands the continuance of restriction causes harm of its own because of this. The Scottish Government has said and will not keep them in place for a moment longer than is necessary. Throughout the lockdown, the NHS has been open for those who need it. And the line with the NHS's Open campaign, Rona Mackay recently told me of a constituent of hers who was diagnosed with cancer of the bladder 5 weeks ago, received surgery and treatment immediately, and so far everything has been good. And that shows you that our NHS has continued to function. But can I please encourage anyone with medical concerns to continue to contact their GP, NHS 24, or attend hospital if their illness is immediate or life-threatening. As we move into this phased return to some semblance of normality, the Scottish Government have instructed health boards to start with the resumption of health services, whose absence is clearly having a detrimental impact on people's lives where it is safe to do so. Published on Sunday, a framework for NHS mobilisation, remobilise, recover, redesign, sets out the core principles that underpin how we can safely and gradually resume some of the services in our communities and hospital setting, which were paused at the onset of this crisis. The initial outline of what services could be prioritised in the next phase of the Health Board mobilisation includes cancer services and expansion of treatments from non-cancer, urgent inpatients and outpatients. Outpatient therapies where delay will increase the risk to patients, such as management of macular degeneration, paediatrics and respiratory services. Mental health support, which is extremely important because no doubt many of us will have heard from constituents with regards to that. Which I think we can all agree these are extremely important and will be made more widely available as time progresses. And care offered at emergency dental hubs will expand while dentists prepare to reopen. As with everything right now, it's important that the remobilisation happens in stages, with constant checking on the prevalence of the virus and the R number so as to keep COVID-19 under control. Health boards will introduce these plans while maintaining COVID-19 capacity and resilience and providing appropriate support for social care. Alongside reopening many health service areas, continued testing for COVID-19 is also top of the agenda. The approach is testing must make sure that we save as many lives as possible and protect the most vulnerable, which is why the 3 current objectives for testing are to support the care of those who are most seriously ill, to support essential workers to get back to work, and to provide surveillance and information that tells us how the virus is spreading and allows us to manage the spread. The Scottish Government has expanded testing and eligibility and capacity considerably, and combined with the Glasgow Lighthouse Lab, we're able to test 15,500 people per week. From the 18th of May, eligibility for testing has now been extended to any symptomatic member of the public across the UK, which will hopefully allow us to be more accurately record and trace where the virus is spreading throughout our communities. But we, Presiding Officer, will equally have to be vigilant in these coming weeks as well. And although things have been hard, Presiding Officer, in closing, I would like to say it's undeniable that we're experiencing and living in extraordinary times. But I'm immensely grateful that we live in a country where top quality health and social care is universally available. Our NHS has held up under unbelievable strain and performed absolutely brilliantly. They will continue to do so, but we must ensure, Presiding Officer, that we continue to give them that support they need.
Thank you very much. I now call Neil Findlay to be followed by Sandra White.
Thanks, Presiding Officer. The COVID crisis has exacerbated the same two greatest challenges that have faced the health sector since devolution, namely health inequality and the broken care system. And to hear George Adams say we have top quality social care, I think is an absolute disgrace. As we look to the future, we cannot repeat the mistakes of the past, where report after report after report has been written about these issues, yet the only thing that changes is that health inequality widens and the social care crisis deepens. COVID, just like cancer, diabetes and so many other diseases, disproportionately affects the poorest communities. There is a clear class issue here, because the evidence is there for all to see. If you're low paid, if you live in a deprived community, you're twice as likely to be hospitalised and die from COVID than if you come from a wealthier one. But you're also much more likely to have been asked to work on the front line, keeping the health and social care service going, the transport system alive and the food supply chain functioning throughout the pandemic. It's bus drivers, train guards, shop workers, cleaners and care assistants that have helped keep us safe and well and fed during the last 9 weeks. Many of these people are in precarious employment and work at or just above the national minimum wage. They cannot afford to take time off because they'll go into statutory sick pay or they'll get the sack. So what are we going to do to address the fundamental health crisis that kills many, many, many more people each year than COVID-19 ever will in this country, namely poverty? Will we use the powers and do everything we can with them to end low pay, to give people security and rights at work, to end homelessness, to create full, stable, sustainable employment, to clean up the environment, decriminalise addiction, fund and staff the NHS, address the mental health crisis and democratise decision-making? Health inequality is the manifestation of economic inequality, and without redistributive, democratic, structural change in the economy, we will never, ever see these inequalities narrow. And yes, if we need new powers to do some of these things, then let us seek to build agreement across party how we get those new powers and how we secure them. In social care, the dogs in the street know the system is broken. It's a sector characterised by a recruitment crisis, low pay, exploitation and insecure work. One where a company like HC1 with 56 care homes in Scotland keeps its profits up on the back of the conditions and pay of its workers, paying zero corporation tax while registering in the Cayman Islands. What the hell are we doing allowing companies like that anywhere near the care of our loved ones? The system needs knocked down and built up from the ground, with a system based on human rights, equality of access, high quality care, and where social care is professionalised, with a career structure, training and paying conditions that recognises the value of the work, the important work being done. Now, on the 6th of March, IJBs were told to reduce delayed discharge by 400. On the 27th of March, they were told to reduce it by another 500. And on the 5th of May, told to go further and that discharge must outstrip admissions. We know that many people were discharged from hospital untested and without a care assessment to either a care home or home care. A policy decision, in my view, that was a disaster, resulting in infections and tragically deaths. Many of these were long-term delayed discharge cases. Patients stuck in hospital, told that they couldn't be discharged because a care home place or package was not available for them. This has gone on for 2 decades, the entire time of this Parliament, and successive governments have failed to get a grip, but it was at record levels prior to the crisis. Then suddenly, as if by magic overnight, thousands of care home and home care places appeared. Did we build all these new bedrooms in care homes? Of course we didn't. Did we create all these new jobs and were people trained and disclosure checked overnight? Of course they didn't. So how did the social care miracle happen? Well, it happened because all of these places existed and these care home slots, home care slots existed all along. They were always there. What wasn't there, of course, was the money to purchase them. And that was down to political choices of this government, who took Tory budget cuts and doubled and sometimes trebled them before handing them on to local government and the IJBs. Delayed discharge has never been about places not being available. That was just the excuse given to families who were waiting on their people coming out of hospital. It's always been about not funding the places. The last social care survey, care home survey published proves this. 37,200 places exist in Scotland, but only 32,500 places were occupied. Almost 5,000 excess places with this existed within the system. But it gets worse, because we know a care home place is around a third of the cost of a hospital bed. A third. So this means in cutting social care budgets and council budgets, what the Scottish Government has actually done is cost the taxpayer millions of pounds keeping our loved ones stuck in hospital. A deliberate policy choice. And because people have been stuck in hospital, it's meant that more people have been stuck outside the hospital and can't get in for the procedures that they need, stuck on long and growing waiting lists. Presiding Officer, if we're going to look at the future of the NHS, I would suggest we start with these two fundamental issues. And if I can make one very final point, Angela Constance in her speech spoke about small care homes, and I agree with her. The tragedy is, when Bailed Housing Association, a not-for-profit organisation, closed all its care homes in Scotland, the government sat back and did nothing.
Thank you very much. I now call Sandra White to be followed by Jamie Halcrow-Johnson.
Thank you very much, Presiding Officer. Like many others, I do welcome the opportunity to contribute to this debate. The pandemic feels though it has been with us for a very long time, affecting our daily lives in a way that most of us will never ever have experienced and hopefully don't experience again. I know our focus over the past few months has been to suppress the outbreak, and the vast majority of our NHS staff and resources have been deployed to care for COVID-19 patients, a move which has been absolutely necessary to help to save lives. And I want, like others, to put on record my thanks and support for all of our key workers, those who have come together to support people across our communities. Have done a fantastic job, and it's been really heartening to see an outpouring of solidarity and compassion throughout our communities. Now, the Scottish Government's framework, Remobilise, Recover, Redesign, it's quite catchy actually, for NHS Scotland mobilisation, sets out those, I would say, probably cautious steps in opening up for health service to non-COVID patients. And I think the framework gives a good indication of what we can expect from our NHS during our phased approach to lockdown. And I would like to take the opportunity to highlight some of the areas concerned and have also been raised with myself. And I think many of you know I'm the convener of the cross-party group on older people, age and ageing, and I'm eager to see how the framework will apply to them. Many people will have reservations and anxiety about attending hospital, particularly if they're older people for treatment. And I would advocate that this was probably felt more by older people and those who have been shielding. And I do welcome the comments from the Cabinet Secretary in regards to looking at current restrictions in regards to those who are shielding. That's very welcome. I look forward to seeing what comes out of that. Now, the people who have been shielding basically have hardly any contact with people outside, and taking the first steps to attend a hospital appointment, for instance, will be for many filled with some sort of trepidation, I would imagine. So it would be helpful if the Cabinet Secretary could perhaps outline what reassurance or alternative steps the Government could put in place to ensure those requiring medical treatment are supported fully. And Presiding Officer, I would like to sort of jump from the older generation to our younger generations and flag up concerns which has been raised by myself and I'm assuming others as well, actually about paediatrics. Whilst we've had concerns regarding the level of service pre-COVID, these concerns have been exacerbated by the pandemic and the pausing of community paediatrics. In the words of one of the professional paediatricians, said to maintain social distancing, we We can't have the same footfall in our clinics. We are doing whatever we can by telephone, video consultation, but I cannot give a child a lifelong diagnosis of autism without seeing them face to face at least once. I need to examine them so that I don't miss signs of an alternative or additional diagnosis. And they are working very hard to disseminate through the expertise and working closely with health visitors and others to link families to good online information wherever it is possible. But they feel it is not enough, and they actually highlight the fact of the knock-on effect on both young people, their families, and also their carers in not being able to access the services. And they say it can be pretty damaging. And they're going to give a few examples in regards to how it can affect families' lives. And they mentioned the fact about child with additional needs. It can result in the eligibility for disability living allowance, carers allowance, and it can support their application for housing, and in some cases support an appeal to the Home Office for leave to remain. So they're looking, I know it's a huge area, but they're saying that without their help they cannot always access that. So really we want to have a look at that particular instance as well. Now, like many others, and I think I'll come on to this as well, it's clear that in the face of a truly devastating pandemic, we do need to reassess our priorities going forward, and we should be looking at protecting and nurturing our public health and our social care system. And I think that must take precedent. I won't get into the same as others have done, but it really must include care homes, which the Cabinet Secretary herself has said is mixed. And we can't continue with a system where over 74% of the care homes are privately owned. Much has been said about it. What I want to highlight in that regard is where the training and conditions, they vary tremendously, and everyone who's spoken is absolutely right about care homes. I just want to say that we have an opportunity here to truly value care and change it, and looking forward, we must use that opportunity. I want to go into dentistry. I know others have touched on that as well, and I do welcome the Cabinet Secretary's comments in regards to dentistry. Like others, I've had constituents and dentists contact me regarding dental services. Dental practices contact me seeking support, ranging from funding to the resumption of NHS funding training for dental practitioners. Now, the framework does state that there will be an expansion of services within the dental hubs, and I do welcome that. However, it would be helpful at this stage, and I appreciate we're very much, taking every step as it comes to opening up the services, but if further information could be provided on the resumption of both dental practices and orthodontic practices. And I know I'm moving out of time, and I'll finish there, Presiding Officer. Thank you very much.
Thank you very much. I now call Jamie Halcrow-Johnson to be followed by Emma Harper.
Thank you, Deputy Presiding Officer. From around the Chamber today and from across the whole of the UK, we've seen an outpouring of support for the NHS and its staff during the current pandemic. Many NHS employees and contractors, alongside key workers, have been at the forefront, the front line of this crisis. While most of the public have been able to stay at home, NHS staff have been putting themselves in harm's way to provide the help and care that people need. Sadly, many have had to make sacrifices. They've lived with the added fear that they may bring the virus home to their loved ones. Some have isolated themselves from their own families for safety, unable to see even their own children. And there are, of course, tragically those who have been amongst the victims of this outbreak. In the fight against the viral pandemic, it's impossible to eliminate risk entirely, but government and the public's prime responsibility must be to help manage and reduce that risk. And we should remember that the response has been unprecedented. Millions have remained at home. The state has stepped in and directly supported hundreds of thousands of employees to stay away from work here in Scotland alone. The nation has shut down in a way that is incomparable, even in wartime. In my own region, I've heard so many stories of NHS staff working incredibly hard to tackle the effects of the virus, and I'd like to thank them for everything they've done. There are, of course, questions over the extent of government's capacity to address the challenges COVID presents. How much can we do in the face of an invisible threat? How far can we change our public services, our ways of working and living in so short a time? There have still clearly been shortcomings, missteps and mistakes, but there have also been huge logistical challenges overcome, things that we might never have considered possible before. And NHS staff have been central to those efforts. So too the civil service and public officials, and of course the armed forces who have been there to help some of the most desperate situations, and our thanks go to all of them too. The core objective to reduce pressure on the NHS and to maintain its capacity is working. It has not been overwhelmed. However, there are clearly lessons to be learned, and we can look to social care, where some of the worst harm has been caused during this pandemic. Despite the integration of health and social care, COVID-19 has cast in a harsh light that social care still remains the poorer neighbour of the NHS. I'm not alone in this chamber in having to pursue proper testing and resources being made available to care homes in my region. We should consider, with regret, the Scottish Government's decision to move patients from hospitals to care homes at the early stages of the outbreak. Patients moved untested into settings where often people are at their most vulnerable. I simply do not accept the argument that hindsight is necessary to make this case. We knew early on that, as with every similar virus, asymptomatic transmission was a risk. While the guidance to isolate based on symptoms was sensible, we knew there was still the risk while symptoms may not yet have manifested or been properly identified. And despite the hard work of the sector, it was less equipped and less prepared to deal with these issues. In many cases, our testing capacity has fallen short, despite its importance in limiting transmission. Too often, despite the Health Secretary's claims, there appears to be a lack of testing kits or lack of access to those testing kits. Testing capacity without availability. This must change if we are to make a success of the next stage of our response. Contact tracing is going to be an increasingly important weapon in the NHS's arsenal, and one that must be delivered effectively as infection levels in the community fall. Without a vaccine in place, it will be the main barrier to harmful future waves of the virus sweeping through our population. In the Highlands and Islands, there is also the potential for greater localisation of our response. In more isolated communities where infection rates have been low or almost non-existent, there is scope for different approaches, but contact tracing must be an essential part of that. We can begin to look as well at other approaches such as others have mentioned, reopening of routine NHS dental services, with a chance to monitor responses and for the public to return to a greater level of normality more quickly. I do recognise, however, that these processes are already getting into gear on a Scotland-wide level. One legacy of the virus will hopefully be a greater use of telehealth to address challenges in delivering healthcare in remote and rural areas. We've seen, as with schools, adaptation that take place by necessity in ways that have been discussed for years, but never brought into the mainstream. We cannot, however, overlook the negatives. For years, I've been challenging ministers on the many issues with our NHS. Locally, for example, NHS Grampian has some of the worst waiting time records in Scotland, and progress toward addressing these has been painfully slow. Ministers must be able to recognise where this pandemic has set us back even further in managing those challenges. Even when the last new cases have passed, change within our NHS will be more urgent and more vital than ever. Deputy Presiding Officer, the threat of pandemics will always be with us, and the legacy of COVID-19 will linger on. Its legacy will be at huge cost in lives and in our economy, and in how we live. But we should also consider what this tells us about the delivery of health and social care in Scotland. This virus has undoubtedly exposed weaknesses in that provision. A more resilient National Health Service is in all our interests, and it's time that words about the value of social care are translated into action. NHS staff and caregivers have shown a huge willingness to help us all through this dark chapter in our history. There will come a time when we should repay that debt by creating a more effective and more responsive public service to the benefit of every one of our citizens.
Thank you very much. I now call Emma Harper. Emma Harper will be the last speaker in the open debate this afternoon. Emma Harper.
Thank you, Presiding Officer. I am very happy to speak today in the debate. I welcome the opportunity, albeit remotely, and I welcome the publication of the Scottish Government's Remobilise, Recover, Redesign framework for NHS Scotland. I, like other speakers, want to put on record my personal thanks to the key workers in my South Scotland region, as well as across the whole country. Thank you, doctors, nurses, NHS staff, health and social care staff, cleaners, ambulance service, porters, police, the fire service, and delivery drivers, and all those carrying out essential services. They all do a fabulous and hugely important work every day and must be commended. I want also to thank people across Scotland for their resilience, for sticking with the lockdown restrictions, and for playing their crucial part in stopping the spread of COVID-19. Without people following the restrictions, and we know how hard that's been for everybody, we would not be where we are today in terms of looking towards establishing a new normal in the near future. Presiding Officer, since the outbreak of COVID-19 in Scotland, our NHS has showed exemplary resilience. In a matter of weeks, NHS boards in Scotland managed to almost double their critical care capacity. Staff have been redeployed, upskilled, and new training has been undertaken. I participated in nurse induction myself, expecting to be expedited to return to the front line as a nurse. But NHS Dumfries and Galloway have not required me to rejoin the workforce. And locally, this has shown that they are very resilient and they have not been overwhelmed. It's been hugely impressive, and the NHS boards, the managers and the staff deserve recognition for their outstanding efforts. However, now, as we move out of the first peak of COVID-19, we need to look at how our NHS moves into the future towards a new normal. And I absolutely endorse Angela Constant's very thoughtful contribution about care homes too. We know that health and the NHS and social care is completely intertwined. The Remobilise, Recover, Redesign framework for the NHS Scotland is a great starting point. The document outlines 3 key aims which should be achieved over the next 100 days. It states that the Scottish Health Service must move to deliver as many of its normal services as possible, as safely as possible. And we need to ensure that we have the capacity that is necessary to deal with the continuing presence of COVID-19. And we need to prepare the health and care services for the winter season, including replenishing stockpiles and readying services. Local mobilisation plans may need to include pre-procedure COVID negative testing and a requirement for self-isolation prior to elective hip and knee replacements, for instance. And in addition, we need to make sure that people know that the NHS is open for all who need it. And I encourage anyone with medical concerns to contact their GP, NHS 24, or certainly attend hospital if your illness is immediate or life-threatening. Presiding Officer, while restoring normal services, we must not lose the gains of the recent period in terms of rollout of new technologies and techniques. For example, we have seen the rapid adoption of digital consultations, such as Attend Anywhere and Near Me. This has meant that many patients have been able to access multidisciplinary clinicians from the safety of their own homes. This has reduced the need for physical attendance for appointments. This is the future, or should I say, this is the new normal for the Scottish NHS services. In rural areas such as Dumfries and Galloway, this has been particularly effective as it has allowed people to access appointments without making the 150-mile round trip from Stranraer to Dumfries. And I welcome this as it shows how adequate and how adaptable our NHS and patients are. Presiding Officer, I'd like to touch on those in the shielding category, our folks with poor lung health conditions as well. All of those in this category have since the beginning of March not left their homes and have not been able to physically see their loved ones. While this has been incredibly hard, there is no doubt that it is unquestionably saving lives. We're seeing south of the border that those in the shielding category are now being advised that they can go out despite the medical and scientific evidence suggesting that it is still too early for this course to be taken. So I am grateful that the Cabinet Secretary has given reassurance to those who are shielding that they are not forgotten, and I thank the Cabinet Secretary for her response to my topical questions earlier. Presiding Officer, a final comment for the future, for the winter prep and for the next wave of COVID prep, is that we need to ensure access to PPE continues in a seamless Scottish self-sustainable way. And I'm aware of the good work that the Cabinet Secretary and Minister Ivan McKee have implemented in tackling the PPE challenges. Self-sustaining on visors and hand sanitizer and and the ongoing work to achieve self-sustainability for gowns and aprons is good work, and I welcome this work and look forward to it continuing in preparation for winter. Last week, I attended the Every Doctor Zoom meeting with several of my MSP colleagues, and Every Doctor, which is a doctor-led campaigning organisation, told a story that was very different about PPE in NHS England. The two speakers were two London doctors, and they were pretty angry at the UK government's handling of the pandemic, especially the failure to supply adequate PPE. They said that Scotland's government and our NHS in Scotland is doing a much better job, and Every Doctor were lobbying us MSPs who attended the meeting to help Every Doctor force the UK government to do better. In conclusion, I again welcome this debate, and I thank all key workers and residents across Scotland and encourage people to stick to the lockdown requirements as we move into the future of our new normal for our Scottish health services. Thank you, Presiding Officer.
We move now to the closing speeches, and we are well over time this afternoon, so would everyone keep to time or below it if possible, please. And I call Anna Sarwar for up to 6 minutes.
Thank you, Deputy Presiding Officer. Can I start, like so many other speakers have done, by thanking all our NHS and social care staff for their commitment throughout this crisis, indeed before and during this crisis. It is no exaggeration to say that there are thousands of our fellow citizens who have risked their lives in order to try and save lives through this crisis. So to each and every single one of them and all our other frontline workers, a genuine thank you. It's right that we applaud them, it's right we thank them, but actually what's more important is what we do after the applause. And that means properly resourcing them, properly paying them and properly supporting them well beyond this crisis is over. I welcome the tone adopted by the Health Secretary. I welcome the fact that we have the time to debate the next steps for the NHS. But I think it's important to recognise that all was not well in our NHS before the COVID-19 crisis. Too many of our NHS staff were telling us they were undervalued, overworked and underpaid. Too many were having to wait too long for vital treatment. Too many were having their hospital operations cancelled. Too many were working far too many shifts with not enough support, and far too many were waiting trapped in hospital as a delayed discharge. And to give one graphic example of that, our delayed discharge rate was the equivalent of every single bed in the Queen Elizabeth Hospital being occupied every single day for a year. That's how many delayed discharge days we lost in our National Health Service. So as we move out of the peak of the COVID-19 crisis, or we hope the peak of the COVID-19 crisis, and we move to the next phase for our NHS, I think we should recognise the challenges we had before and how we address them as well. Many speakers have mentioned the fact that the NHS is still open. I think that's a really important message to get right across to the public, that our NHS is open for other forms of care, and I'll come back and touch upon that in a moment. But I also want to recognise that we have seen some innovation from the NHS through COVID-19. Many of the things that we were told weren't possible and couldn't be done quickly were done very, very quickly. For example, online consultation, for example, the sharing of medical information with pharmacies. All of these things were things we were told were blockages in the past, but now happen very quickly. I hope we can maintain some of that development and innovative thinking that we've had through this crisis, beyond this crisis as well. In terms of the next phase, there is one part around PPE. I think we need to make sure we're adequately supporting all those frontline workers in terms of PPE. There is still a testing issue. I don't like when governments, whether they're UK governments or Scottish governments, hide behind capacity and not about actual testing figures. I don't want us talking about capacity, I want us talking about tests. It's right that we shout down Boris Johnson and Matt Hancock when they talk about capacity, but we should do the same test then on the Scottish Government. I think it is unacceptable that we have the lowest testing rate of any of the 4 nations in the UK. And if we are to make, rightfully, test, trace and isolate the way we get out of this crisis, then we need to test more and test. And as part of that, I think we should be implementing a test guarantee for any individual that wants a coronavirus test in Scotland. We have the capacity. We should guarantee them that they will get a test and then get their result within 24 hours. So 24 hours to get a test and then 24 hours to get the result. I think that is a guarantee that we can implement across Scotland. I'm also worried about the unintended consequences. I've raised this before in the Chamber. I know that Miles Briggs also raised it in his contribution. I fear that there may be unintended consequences in terms of people losing their lives because of the response to COVID-19 rather than COVID-19 itself. And one example of that is around our cancer services. I really worry about the fact that we have 2,000 less referrals for early diagnosis. I really worry that people aren't able to access vital cancer treatment through this crisis. I really worry that lots of treatment will be delayed, and I really worry that we have what I think is a too slow phased approach to reopening our cancer services here in Scotland. Cancer remains Scotland's biggest killer, and if we are to confront Scotland's biggest killer, we must restart cancer services ASAP and without delay in Scotland. Other people have mentioned dental services. I also think we have a mental health challenge. We will have a mental health pandemic after this COVID-19 pandemic because of the stress and the strain of this pandemic, but also the consequences of it. How we address that mental health pandemic that is coming in Scotland, I think, is also going to be really, really important in terms of the next phase. I realise I'm short of time, Deputy President Officer. I just wanted to mention two other really quick things. One is the Cabinet Secretary rightly outlined an NHS improvement plan. I wonder what stage that plan is at now, considering we will have much more of a backlog in terms of treatment. There was a previous promise to amend the Patients' Charter to give accurate waiting times to patients in terms of how long they'll wait for their treatments. What communication is happening with patients now? I also think we are still being too slow in terms of how we can get people access to loved ones who are in acute settings, who might be in their final period of their life. I don't think it's right that in 3 weeks' time we're probably able to be 2 metres apart from a stranger in a Primark store, but perhaps not 2 metres apart from a loved one in a hospital. You can only do it now. I've realised the Cabinet Secretary says you can do it now. You can only do it now right at the final moments. I would much rather we had a situation where someone is in the final period of their lives, perhaps the final weeks, perhaps the final months, and are able to have access to their family members, not just in their final minutes or hours. And I think that's a really important difference that we need to make. I know there's a longer debate to be had around care homes, but I'll stop at that and I'll look forward to the Cabinet Secretary's response.
Thank you. And I call Brian Whittle for up to 7 minutes, please.
Thank you, Deputy Presiding Officer. I think once it's over, without a doubt, we will be studying the impact of COVID-19 crisis for years to come. There will be ruminations over who did what and when, what should have happened and why we didn't see this coming. If I can use some sporting parlance, Deputy Presiding Officer, everybody wants to pick the team after the final whistle. And what we've heard today, we heard from Jamie Halker-Johnson talking about the care sector, which has been the poor relation of the health service for too long. We need greater integration of health and social care. We've heard about IJBs need to be made to work for all partners equally, and I think the Health and Sport Committee investigations that have been going on have shown that this is not the case. We need more services close to where people live. We need to put a stop to towns and villages losing their GP surgeries. We need a greater emphasis on public health and tackling preventable illness. Miles Briggs touched on the healthcare issues surrounding from lockdown, specifically cancer, and I was on that same call with the Every Doctor briefing, and they said that the reduction in cancer screening, they fear, might result in up to 18,000 more cancer deaths coming down the road. And Anna Sawa there has discussed the mental health crisis that is inevitably coming our way. The Scottish Government asked for support from across the Chamber, and that's what it got. Throughout the pandemic, I think we can all appreciate that the majority of MSPs have, for the most part, put political tribalism aside. The value of Parliament cannot be underestimated at a time like this. It is a role as a source of scrutiny, both of legislation and of decision-making by ministers. It is a filter against poor decisions and an incentive for improvement. So it is a concern to me, and I know for many across the Chamber, the way in which the Scottish Government have sought to undermine Parliament's ability to scrutinise its actions. I think that inevitably causes suspicion with both parliamentarians and the media. For example, the lack of transparency around the Nike conference outbreak. I spoke to a father of one of the delegates who ended up in hospital with COVID. No one from that government has spoken to that person. It was Nike who warned the delegates to get a test. So if neither the delegates, the hotel staff or any other group they interacted with were contacted by the tracers, who exactly is it the government are claiming that have been contacted? We have the catastrophe in our care homes, where thousands of untested hospital patients were transferred to care homes in March, despite the Scientific Advisory Group on Emergencies repeatedly warning that people without symptoms may spread the virus. The Scottish Government have consistently tried to deflect, and I think what we've heard today is the testing protocol suggests lessons are not being learned. Did you hope that we wouldn't ask questions or wouldn't find out? Transparency is crucial if you want Parliament to take Parliament with you. Mistakes were always going to be made. We accept that. What this Parliament cannot accept is deflection and avoidance of proper scrutiny. Mistakes have been made, no doubt, but the world was not set up for this crisis. To me, it's the lessons we learn from this crisis and the steps we take to prevent the next one that we should be judged on. COVID-19 has highlighted some serious flaws. I'll take an intervention.
Neil Findlay.
I have no trucks for the politics of Mr Whittle, and indeed I hope his counterparts at Westminster are asking the very same questions. But he is absolutely right that when we ask about scrutiny, we are doing our job in this Parliament. We have every right to find out what is going on. And the more that people on the government backbenches moan about it, I can tell you this, I for one will be asking those difficult questions.
Ryan Whittle.
Thank you. I think the outcome we should all be focusing on is delivering long-term, sustainable, quality health care free at the point of need. And to do that, we need a world-class environment for our world-class healthcare professionals to work in. And we need to make sure they are properly remunerated and properly resourced. And I want to focus the next part of this on, I think, what's the essential first step. Now, I could write about technology and education, given the need for online learning and a recognition that that is far from an equal playing field. Similarly, I could highlight the need for better use of technology in the justice system or the welfare system, both of which have been under pressure throughout the COVID pandemic. For all these portfolios and more, I think the Scottish Government have been content with a make-do approach. Decisions on investment have been based on whether they can get by with what they have. And let's face it, they don't have a great track record when it comes to developing technology platforms and software. So I can understand the reluctance to adapt. COVID has highlighted that access to quality data is a huge problem. Indeed, the Scottish Government's inability to measure the R number, that measurement of the replication of the virus, accurately is in no small part a failure of quality data gathering. I'll take an intervention from the Cabinet Secretary.
Jean Freeman.
Would the member care to cite for me what evidence he has for the assertion that the CMO's advisory group and our analytical teams are not able to estimate the R number? Where is your evidence for that? They publish it, they show you. Where's your evidence?
Ryan Whittle.
Thank you, Deputy Presiding Officer. It's quite simple. It hasn't changed for the last 5 weeks, so that would actually tell me that nothing has changed in the last 5 weeks. And the reality is this. The reality is this. The R number it's been 0.7 to 0.9 for about 5 weeks. And what that is, it's about data gather. You have to gather better data. The R number is a major contributor to the way in which the virus is being tackled. And yet you are unable to tell us with any certainty what it is or how accurate it is. Everybody has a unique KI number and that identifies us within the healthcare system. We should have been able to quickly identify and contact the most vulnerable by looking at the data and automatically generating a letter, an email or a text. Instead, it took weeks, and even then, there were too many mistakes. How and what we record about an individual, how that data is accessed and used, crucially, who owns that data, I think is key. Health boards across the country currently use different systems that can't speak to each other. This means that if you record data in Glasgow, you'll need to record that again in Edinburgh if you need the same treatment in Edinburgh. And the same is often true for patients moving between primary and secondary care. Their medication advice or rehabilitation protocols aren't available to GPs, pharmacists or physios at the touch of a button. I realise my time is short, Deputy Presiding Officer, so what I will finish with to say is, to date, there has been a that'll do philosophy. Our ability to utilise big data properly isn't new, but the current crisis has brutally highlighted this failing and has moved forward to tackle the long-term sustainability of our NHS, to support and enhance the working environment of our NHS staff. The adoption of technology is the first crucial step that must be front and centre. But perhaps the question we should ask is whether it should have taken a global pandemic before we start considering these challenges. Deputy Presiding Officer.
I call on Jean Freeman to respond to the debate for up to 9 minutes. Please, Cabinet Secretary.
Thank you, Presiding Officer. And can I start by thanking members for all of their contributions. I have made a very careful note of all of them, and I won't be able to mention very many at all in this response. But can I just say, before I go on to say what I am going to say, that I absolutely welcome scrutiny. It is absolutely the job of this Parliament. But let me say this. The fact that you might not like the answers we give does not mean that we're not open to scrutiny. And the fact that you might not understand them does not mean we're not open to scrutiny. So, Mr Whittle, I am very pleased to offer you the opportunity to sit down with our Chief Analyst and have that R number explained to you again, so that you will not impugn his professionalism again. Now, the really important thing I want to say, Presiding Officer, at the start of this summing up, is there's a bit of the tone of this debate that's worried me a wee bit, and that is a wee bit of a tone that implies that COVID-19 has gone away, that we're past the peak, we're past the difficulty. Yes, there is a reduced incidence in the number of cases, but our headroom is limited. NHS does still need to be ready to cope with the challenge of COVID-19. And that is why the plans that we have asked from boards for the initial 100 days require them to hold capacity for COVID-19. As we look at how we remobilise and restart our NHS, there are a number of factors that we need to keep a close eye on. What happens to that incidence number? What indeed happens to that R number? What would be the impact of the changes that my colleague Mr Matheson will introduce in terms of transport? What will be the continued demand on our health service for the support for the care sector that they offer and of test and protect? And overall, what will be needed to ensure that patients feel safe in returning? All of that are demands on our NHS staff. And I want to quote something that has come, I think, to all members from Unison. Staff are tired, both emotionally and physically. We must not overwhelm them. That is the recover point. That is about recognising that we can't ask staff to do everything that they have done on Friday and on Monday, keep up that pace, continue to do what they're doing and add in all these extra things. So Ms Lennon is absolutely correct when she says that this will be about months of careful planning, and those plans may change as they go. I share the worry, and have done from the outset, of members across this chamber about the health impacts of some of the areas that we had to stop. I understand and know too well the health impacts that Cancer Research UK and others have highlighted for us, that we have highlighted in looking at the significant reduction in attendance at A&E, the significant reduction in urgent referrals from our primary care colleagues. But the first set of plans, therefore, cover only to the end of July. To get this right, we need to take time, not only to continue to keep that very close eye on what is happening to the virus, but to engage with those important voices. So the immediate priorities will be to reinstate cancer care, including safely restarting screening, much as has been said already. Elective care, where we can start that, cardiovascular work, and in primary, dental, pharmacy, optometry, all of them will begin to pull their plans together and introduce those services. That includes mental health services. for the general population and young people, but also to build on the extensive work that has been undertaken for health and social care staff in terms of their mental and emotional well-being, including coaching and trauma counselling. All of it matters and all of it is important, as does safe spaces, which Mr Briggs mentioned, for patients in terms of their treatment, and consideration that we will give to the additional use of testing in healthcare settings. All of that is critical as we look too at the social care requirements that have been argued for and the review and the consideration that needs to be taking place there. That is an immediate but also a long-term prospect for us. In the coming weeks, we will set out details of the services we will restart and in what way. I need to say that some of that, in terms of the extent or the pace, will be influenced by local circumstances and influenced by that need to allow our healthcare workforce to recover. But health ministers and I will ensure that Parliament is informed and in the future has opportunity to both debate and engage in shaping how the health service emerges as this pandemic progresses. But the final thing I want to say is this. It really is important that every single one of us understands that COVID-19 has not gone away. Yes, we have suppressed it. The population of Scotland has achieved that by all that it has done, all that it has sacrificed. But the headroom is small. And so we need to continue to push hard on that public health message about staying at home, about remembering that 2-metre distance. That 2-metre distance, by the way, will influence some of the ways in which our health services will restart and will restart slowly. All of that public health message is critical, not just to the health of the people of Scotland, but to our opportunity to use whatever chance we have to begin to restart our NHS. Thank you.
And that concludes the debate on COVID-19 next steps for the NHS, and it's time to move on to the next item of business.